curious, how was your internship last semester?
It wasn't that bad.
Wasn't that bad?
Well, there wasn't a lot of hands-on experience with APIE actually in itself. I mean, the first day I got to lead bingo, but it wasn't actually explained as to why I was leading bingo. Like, they didn't explain the benefits of it. So, and like the facility also had a pre-programmed activity calendar for each month, so I didn't really get to plan the activities themselves.
So did you get any practice with the process?
Well, I mainly got some experience doing the assessments with the residents. Like, I got to go to each room and interview the residents, but the assessment was very standardized and a lot of the residents had questions and I couldn't really deviate from the assessment like to explain the questions.
That makes me really nervous because I have my internship next semester and I'm hoping to learn like all that in the internship.
Yeah, don't count on it. I mean, unless we start discussing why we're not learning these experiences in our internship and practicum, then nothing's going to change.
Welcome to our TEDx video on the use of the APIE process in the field of therapeutic recreation, or TR for short. APIE is an acronym which stands for Assessment, Planning, Implementation, and Evaluation.
The TR process, known as APIE, is implemented for every individual client with whom the TRS is working with. This provides direction for the design of TR programs. The process consists of 4 main steps: assessment of the individual client and their surrounding world, planning the specific goals or outcomes, objectives, and TR interventions needed for the client, implementation of the therapeutic recreation plan, evaluation of the client's progress, and revision of the plan or program if need be. You may ask why it is important to discuss this process. Well, the APIE process is the backbone of programming and one of the first things we learn in our TR classes. It is also knowledge that we take for granted as ethical and professional TR practitioners. We need to continuously question how TR is practiced and why. Why is the APIE process so important to our practice, and how is this process done in professional practice?
As Kunstler and Daly assert that each of these steps of the APIE process has a multitude of components. This means the process may and should have more than 4 steps. However, in many TR students' experiences, they do not get the opportunity to see these multiple steps. In addition, as Kunstler and Daly state, this TR process should always be carried out in the delivery of TR services, regardless of setting or population served. In other words, this process is supposed to be usable in any TR setting. We question this statement because if the APIE process is supposed to be always carried out in the delivery of any and all TR services, then why aren't we seeing and practicing the full process in places like long-term care, nursing homes, community facilities, and many other institutions? In our education, we are taught that this process is meant to be the basic structure of how and why we develop and implement recreation programs, and yet the actual implementation of this process seems to be lacking in many different settings. Lastly, if part of the TR professional competency requires the ability to implement quality assessments and quality improvements within programming, this requires TR professionals who are designing and evaluating these programs to determine whether or not the systems and processes of care that are in place are truly achieving these individualized holistic goals.
Realistically, as we graduate, we will be working in settings with small interdisciplinary teams and will have limited access to current TR professionals. In these small teams, we will be introduced to only a sample of techniques used by those we interact with. As we learn few forms of assessments and evaluations in classrooms, we are expected to learn on the job, begging the question of how feasible is that expectation. While in different courses we have touched upon various types of assessments, we know that not every assessment is right for every client. Therefore, we have a pool of assessments from which to choose. We are taught and provided with a working knowledge of assessment to use within our professional practice. In contrast, courses have provided us with little background about evaluation. We leave school without any true knowledge on what it means to do an evaluation, or how to practically complete one. We don't have a basic toolbox to draw from for evaluations. So when we enter the fields of TR in our practicums and internships, it almost feels as though we are being asked to perform a surgery with no medical knowledge. Therefore, we wanted to know if the feeling was mutual with other students in the TR profession. So we asked. We wanted to understand what application of APIE looked like currently in the field. And we wanted to know if students understand APIE through first-hand practical experience, knowledge learned from formal education, or both. These are the results we could identify when opening the conversation with both TR students and professionals.
When in school, we are taught that APIE is the best way of conducting TR programming, but through our surveys of the students, only 35% believe that APIE is the best process in programming, whereas the remaining 65% believe that APIE can be useful, but it is not the absolute best means of conducting programming. 2 of the 14 students specifically stated that APIE is not the best way, and 3 of 14 suggested that it may be beneficial in certain circumstances, though not always the best way. 29% of students suggested APIE could be used as a guide, though TR should not be limited to the APIE model, despite being taught that APIE is the best practice.
When talking about the actual use of the APIE process in practical student experiences, specifically referring to evaluation, 86% of students agreed that they had experience in completing evaluation, although most of their opportunities were limited to informal evaluations that focused specifically on client participation and attendance. One student stated, "Formal evaluation was not really a part of the process at my placement. The focus of my practicum was to run programs and activities." And 14% of other students said that as they were only students, they were limited in their opportunity to complete evaluations. As students practice as interns, they expect to be guided and taught, and these experiences only minimize the importance of program evaluation. Their role lies primarily in program implementation, but they lose valuable opportunity in applying all stages of the APIE process. Looking at the themes and results from our student surveys, we can see that many have used some form of implementation, but do not feel confident in using a variety of assessment and evaluation tools. In addition, this raises the question, as students we gain our knowledge in education, but are supposed to as well in our practicums and internships. If this process is supposed to be reflected in every setting where TR is practiced, then why are the experiences of students' implementation so varied? As students, our experiences are all different in terms of setting, population, programming, and a multitude of other differences. It is important that in educational institutions, there is a better foundational base with the APIE process to provide for future and current students in the field of TR a better selection to choose from. We also need to consider the experiences of current TR professionals and their use of the APIE process to judge what students need to gain in experience and knowledge before entering the field.
Now to the professionals. If TR is to have some sort of standardized process, it should be emulated or adapted in all environments where TR services are provided. Is this true in TR practice? Through the use of our survey, we were able to find that 97% of professionals believe that the APIE process is in fact the best process for TR programming. Those who disagreed worked in the community and found it too rigid and medicalized. However, there were many more professionals working in community settings that found it beneficial as a guide. They just implemented the steps in a flexible, creative way. A quote from a professional: "I think APIE can be applicable in every TR setting. However, it will look very different in each setting depending on the environment and the population you are working with. Working with children in a community setting, our TR process will look very different than they would in a hospital. However, APIE gives a good basis and theory to look at your programming from start to finish in a holistic manner." When asked if the APIE process is medicalized, there was much controversy, but majority said yes, it was medical. A professional said the following: "Yes, APIE is medicalized, but only at face value. The depth and breadth of the 4 aspects of the model can be made inclusive to the patient experience in TR services that includes all domains: physical, emotional, spiritual, social, and cognitive. In the typical medical model, the physical domain dominates without as much emphasis on the 4 aspects of life. All must be considered as a part of TR service delivery." Furthermore, even though there was a high amount of professionals that stated that the APIE process should always be carried out in the delivery of TR services, regardless of model being practiced, only 75% of professionals complete evaluations. Also, when asked how often they evaluate, only 60% of professionals respond with often or always. Most of those who responded that they don't evaluate worked with seniors in retirement homes, long-term care, and day programs. When asked why, many stated lack of time as a reason. Regarding evaluations, it is clear that the focus of the evaluation and type of evaluation tool used is based on whether the TR practice is based on medical model or other models valuing leisure and holistic well-being. Those working clinically were more likely to use formal evaluation tools measuring functional outcomes, while those working in less clinical places, such as retirement homes and community centers, were more likely to use participation rates, observation, and participant feedback regarding whether they liked the programming and felt it met their leisure needs.
When looking at how often the efficacy of interventions are evaluated, a striking comparison emerges. Only 40% of professionals reported always evaluating the efficacy of an intervention compared to 7% of students. What is even more surprising is that the majority of professionals reported program efficacy as one of the most important aspects of what makes a good evaluation. This calls into question why there is such a discrepancy among emerging TR students and current professionals. Hence, if evaluating is so important, why do 60% not regularly evaluate? Why is more time not afforded to ensure our efforts are worthwhile? Then, when looking at those who responded almost always, which was one category down, 29% of students reported almost always evaluating the efficacy of interventions. This compared to the 14% of professionals reporting within the same category. Once again, we question why there is such a difference. Are we evaluating more as students than we are as professionals?
When we use APIE in the field, it is important to analyze the intersectionality of a client without forgetting to care for and care about. This means we have to recognize that all individuals are different and are complex human beings. Therefore, if we use APIE, this process must encompass all of these factors. In addition, professionals should not dominate the conversation. We have to make sure that the power relationship is equal with the clients. Furthermore, our survey does have limitations whereby we were constrained with time and a limited number of responses to our questionnaires. We implore fellow professionals and students to continue to critically look deeper into the practice of APIE and to continue to further this research and discussion, as there is a limited amount of research regarding the actual use in professional settings. The lack of evaluations taking place with older adults is something to further investigate, as evaluating the efficacy, true value, meaningfulness, and how well it aligns with our goals. This is crucial to successful programming and interventions. Client groups are always changing and our skills will always need sharpening, and we need to continually reflect on our current and future practice.
Some suggestions for future practicum and internship students. Take initiative in your learning. Be vocal about your wants and needs. Don't be afraid to ask questions. Your supervisors shouldn't expect you to be experts already. Be present. Don't take this experience and opportunity for granted. Some suggestions for improving the TR curriculum. Add in more courses pertaining to assessment, planning, implementation, and evaluation, and go more in depth. Teach us more about practicing across many settings. The current curriculum is too clinical and does not address other settings such as community recreation services.
We would like to end our TEDx video today, not as an ending or an answer to discussions surrounding the current practice and use of APIE, but as a point to start reflecting how we as future practitioner educators and acting professionals can best use the process to better the experience of our clients. We recognize the need to have one overarching process that all TR specialists should use to add legitimacy to our position. We ask you to think about current education application implementations of one of the few standardized practices across TR, a profession with no singular philosophical practice. We want to leave you with a few things to ponder as we conclude. What, if anything, is lost in TR when professionals neglect the use of the APIE process? Who faces the greatest loss when the APIE process is not implemented as it was intended? Why was the APIE process created? Is it still meeting the objectives it was created for? And is there a better way that we can meet those objectives now than before?